Hi guys, Dr. Siana here. So as many of you guessed, the horse in this video is displaying signs of tetanus. So tetanus disease is caused by a Clostridial bacteria that enters the body through a wound, and then after it proliferates and those bacteria start to die off, it produces a neurotoxin that causes these signs that you're seeing here in this horse. So the clinical signs of a horse that's affected with tetanus are first and foremost going to be they've had a wound within the last few weeks. And these wounds could be anything from a small puncture wound to a hoof abscess to even a newborn foal that has an open umbilicus. And they'll first present with some generalized muscle stiffness, and it might even look like a lameness, but will quickly progress to what you're seeing in this video here with the abnormal gait and trembling and muscle spasms. Another thing that you may see early on in the process of this disease is protrusion of the third eyelid, like you see in this video here. Now, any of these clinical signs can be made worse with excitement. So that can be loud noises, they might be hypersensitive to touch, and these horses are going to quickly progress to having such bad muscle rigidity that many of them will not be able to rise. So cases that are caught early on in the disease process, meaning that your horse is still able to stand and still able to eat, can be treated. So we're able to treat those cases with antibiotics and antitoxin, but the mortality rate for tetanus is around 80%. So the likelihood that your horse will survive if they contract tetanus disease is quite low. So the best method to keep your horse from dying of tetanus is prevention. So horses are vaccinated against tetanus annually, and if your horse has any type of wound whatsoever, they should have a tetanus booster vaccine if they haven't been vaccinated for tetanus within the last 3 months. So I hope that was helpful. You can let us know in the comments if there's any other topics that you guys would like to talk about. Goodbye, I'll see you next time, and vaccinate your horses.